And extremely good news now that the AMC MCQ test centers have been announced for Pakistan. This had been the news that we'd been hoping for a long time. Finally, it's officially been declared that the Pearson venue centers will be conducting AMC 1. Previously, all the doctors in Pakistan had to go to Thailand, had to go to Malaysia or Turkey to do AMC 1, but now they can do it right from home. Two main important things: that first of all, they have got now third option on top of USMLE and PLAB. Plus AMC 1, as I always say, that it never expires. It's based on final year medical subject. And the third thing is that AMC 1 could be taken for any doctor. It could be a junior doctor who's just finished his house job. It could be a middle grade doctor who's got a couple of years of RMO experience. Or it could be even a senior doctor who is willing to come in his own specialty but would want to start more generally here in Australia. We have got AMC courses. We have also got a complete plan of study to take you through in terms of resources. Have a look at this complete video in which we have laid out a plan how to pass your AMC. I'm sure that you'll find the content of this video very useful if you're thinking seriously about Australia.
Whether you're a junior or a senior doctor and thinking about Australia, you must consider AMC 1 as it's the only exam that never expires, and it also helps you apply for both junior as well as senior jobs, and hence its applicability is more practical for all doctors. I'm going to make extremely simple and give you a complete roadmap of how to pass your AMC MCQ exam, which is also known as AMC Part 1 exams. Now, I'll also give you my personal 12-week topic-wise study plan. I'm going to divide this conversation into eligibility and how to book the exam and the fee structure, the topics and the types of questions and the time of the exams. Number 3, key resources like books, Q banks, mocks, and guidelines. I'm also going to talk about 12-week study plan that I've just highlighted, and I'm also going to talk about preparation time and pro tips. Lastly, I'm going to talk about the job market after AMC Part 1. International medical graduate who wish to practice medicine in Australia must pass AMC Part 1 exam as a part of the standard pathway towards the medical registration. To be eligible, the candidates must hold a primary medical qualification in medicine and surgery from a university recognized by the Australian Medical Council. They need to register with the Australian Medical Council by making a candidate portal and having their medical degree verified through the Educational Commission of Foreign Medical Graduate, which is ECFMG, via AMC Portfolio. Now, booking. It's a two-step process. In step 1, AMC Portfolio registration, create an account, the AMC candidate portal, submit the documents for the verification through Epic Portal and ECFMG verification. Step number 2, exam scheduling. Once you're eligible, your MBB has been confirmed, it's both at ECFMG and Epic Portal as well as AMC Portal. Now you can apply and schedule your exam. The current fee in Australian dollar is 2920. It's very important to check the latest fee on the AMC website. You also need to create the AMC portfolio, which is 642. Exam structure. It's about 150 MCQ questions done in 3.5 hours. It's a computer adaptive test done entirely on computer, and the difficulty level of each questions adjusts the next subsequent question. Also, there is no review policy, meaning that you cannot go back and alter your answer. There is also no negative marking. The type of questions are single best answer or SBA questions. MCQ, choose one correct answer from 5 options. Image-based MCQs like X-rays, ECG and clinical images, and data interpretation MCQs like lab results and case scenarios and ECGs and all that. Final score is scaled from 0 to 500 and pass mark is 250. The topics which are covered: adult medicine 30%, adult surgery 20%, obs and gynae is about 12.5, pediatrics 12.5, mental health 12.5, and population health and ethics is 12.5 as well. Now, study resources I'll divide into books, Q banks, trials and guidelines. But before that, I'd like to tell you from my own experience. Being a busy doctor, I did not have time to navigate the AMC MCQ study. Also, more senior doctors who are specialists and they want to take the AMC MCQ exam do not remember much about the basic clinical subjects from final year. So that's why I created 12-week emergency focus AMC MCQ course with Dr. Laura and our team of amazing tutors. Our course has live tutorial sessions based on all the topics, plus all recordings and most detailed notes are available through our portal, and trial MCQ questions are there as well. And what's great, we even now have lifesaver course at the end of each of our 12-week course to refresh the key topics right before the exams. We are currently #1 AMC MCQ provider in Australia and have 4.8 star rating on Trustpilot based on hundreds of independent Trustpilot reviews. So do check us out. The website is www.emergencyfocus.net/AMC. Now let's talk about the books. AMC Handbook of Clinical Assessment. This book is, even though utilized primarily for AMC Clinical, but it is also an absolute gold for AMC MCQ, complemented by AMC Handbook of Multiple Choice Question. Both these books were synergistic in help me cover lots of subject in a very short span of time. John Murtha, General Practice. This is mostly a reference book and I used it for my medicine related subjects only. No need to go cover to cover. Oxford Handbook of Clinical Medicine. Now I did PLAB before the AMC MCQ exams, so I had read cover to cover and memorized most sections of Oxford Handbook of Clinical Medicine, and I found some of the sections were directly relevant to AMC MCQ exam as well. For question practice, AMEDEX is an absolute must, and I would also recommend Canada QBank. The trial exams you can do GP Pass and M+X. Now guidelines are absolute vital. Royal Children's Hospital Clinical Guidelines, RACGP Guidelines, Australian Therapeutic Guidelines, Emergency Care Institute Guidelines, and Royal Women Hospital Guidelines. Recalls. At least last 2 years of recalls are important, and I'll tell you a very important thing. Recalls are important for gathering important information about the topics which are in the recurrent thing, but not for the exact ditto questions, because most of these questions, as they are recall, they don't have the level of depth and correctness to be actually relied on, including the answers. Now exams results are generally released within 4 weeks of the exams and are available on AMC MCQ candidate portal. The results includes pass, fail at status and also your scores, but as I said, the scores really do not matter in terms of your eligibility for AMC clinical or for the job for that matter. Now 12-week personalized study plan. I would suggest that 12 weeks is a good number for even a doctor who is busy, provided you are complementing that with a good study plan and you're dedicated and disciplined. So week 1, build a strategy of the exam, understand the AMC 1 format, go through the question types and set up a study resources. You need to collect all of those books and online resources and create a daily schedule of study, and then begin light question practice. Attempt 20 to 30 MCQs in a daily form, which will get you started about what this exam is, what is the difficulty level like, and where do you stand right now. Week 3 through 4 is adult medicine and surgery. Now they have got a combined total of 50% of the exam, so you need to do it very well. Your goals through this week 2 and 3 should be master the core medical and surgical topics. So topics to cover in adult medicine include cardiovascular, especially hypertension, heart failure, acute coronary syndrome, valvular disease, respiratory, COPD, asthma, pneumonia, PE and interstitial lung disease. Lots of questions from there. Endocrinology includes diabetes, thyroid disease and adrenal disorder. Lots of questions from there. Neurology, stroke, epilepsy, meningitis, neuropathy, nephrology, AKI, CKD, glomerulonephritis, gastroenterology, liver disease, IBD, GORD, and pancreatitis. Adult surgery. Now 20% of the questions will come from adult surgery. These include acute abdominal conditions like appendicitis, cholecystitis, pancreatitis, trauma and fracture management, wound care and post-operative complications, hernias, vascular surgery, and urology. Now, Handbook of Clinical Assessment, Emergency Focus Scores portal. Our portal, we've put in a lot of effort, and you can read all of these topics from the portal alone. And make flashcards, your own flashcards, so you can refer on to those difficult topics in your own writing at the end of when the exam is near. Week 5 to 6, women and children or child health, combined total of 25% of the exam. The topics to cover in obs and gynae, which includes pregnancy complication, hypertension, gestational diabetes, preeclampsia, labor and delivery, CTG interpretation, normal versus abnormal labor, postpartum hemorrhage, infections, complications, gynecological condition, polycystic ovarian syndrome, fibroids and endometriosis. Pediatrics, neonatal conditions, jaundice, sepsis, respiratory stress syndrome, common childhood illnesses like asthma, bronchiolitis, pneumonia, and growth and developmental milestones, vaccination schedule, although you don't need to know it by heart, but have a general understanding of Australian vaccination schedule. This is very guideline oriented, so read RANSCOG guidelines in obs and gynae. Also Royal Children's Hospital guidelines are an absolute must. You also need to use Murta for reference only, but week 7 to 8, mental health and population health, you need to have a broader understanding about the psychiatry and all the associated conditions, especially some of the conditions which are, like bipolar disorder, schizophrenia, suicide risk assessment, substance use, alcohol, opioid, psychotropic medications, side effects and indications. Population health is one of the things which we don't really know about much. It's 12.5%. So, you need to know about Medicare, PBS, NDIS now recently after it's been introduced, but it's not a deal breaker. You'll have 1 or 2 or maximum 5 questions from it. But one of the things which is important is informed consent, confidentiality, epidemiology, and screening programs like breast screening programs, cervical and bowel cancer screening program, and vaccination policy. So do go through the immunization handbook. So read from Emergency Focus portal. We have got an extensive amount of information in psychiatry and public health, so do read that. Week 9 to 10, image interpretation and clinical application. Now this is what I call is a clear giveaway marks. Improve ECG, X-rays, CT, and basic interpretation of CT and ultrasound. Practice 30 image plus MCQs per day. Best to do our emergency focus ECG and radiology workshop that we do for all our participants. Week 11 and 12, final review week and mock exam. So this is the exam leading. These 4 weeks need to be just reinforcing the weak areas, improving the time management for the exam. So action plan is attempt full length mock exams, time practice, trial exams. You can use the site, as I said, GP Pass, M+X. Now my tips are simulate real exam conditions, like 3.5 hours of full length practice exam. You don't have to do it every day, but just once a week. Use flashcards. I made my own flashcard, but there are other flashcards available as well. AMC MCQ is one of those exams where you really do not need to have many group members, but I think it helps when you're discussing a certain topic or going through certain MCQs, as long it's it's planned right and you're not wasting time talking about other things apart from the exam. On the exam day, at least 1 hour before, reach your venue. Relax, don't talk to each other, stay calm and confident. Also read each question carefully, because sometimes when you do too much recalls, you are under the mind frame that, oh, this is the recall with that answer. No, it does not work like that. Read each question very carefully before answering. After passing the AMC 1 exam, candidates can apply for medical jobs throughout Australia under AMC standard pathway. This is by far the biggest job pot and starts via the recruitment campaign, which starts early in April and goes towards the end of September. So what jobs after AMC that you can apply for? Well, you can apply for any job apart from a consultant or VMO position, resident medical officer job, PHO jobs or principal house officer job, senior resident medical officer position, registrars, fellow position, internship position. You can even apply for ICRP or International Clinical Readiness Program and clinical observations. Now, where to apply? Job portals are linked on New South Wales Health website, also South Australia Health website, Victoria Health Jobs, Northern Territory Health Jobs, Queensland Health Jobs. Indeed and Seek are also one of those websites where the jobs are advertised. We have also got a complete career guidance course where we can send you the jobs and you can apply for those jobs, and we'll also make sure that your CV and application selection criteria questions are up to the mark. Start early and practice MCQs daily. Use my structured 12-week study plan, which I've just told you. I hope you found this guide to be very useful. Best of luck, and do review our course for your best study action plan. Look after yourself and each other, and I'll catch you in the next video.